Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
MT is a 39-year-old female being seen by the psychiatric mental health nurse practitioner for a major depressive disorder. She's being managed with SNRI therapy in combination with cognitive behavioral therapy, but is having difficulty achieving remission. Her husband is becoming very frustrated. 2 years ago, she had an episode of depression when her sister died in an accident, but after 6 months of treatment, she seemed to return to normal. Her husband says she has nothing to be depressed about. In trying to help MT's husband understand the disease process, the psychiatric mental health nurse practitioner discusses with him that A, the physiologic stress accompanying the first episode of her depression may have produced changes in brain biology that make her susceptible to subsequent episodes without an external trigger. B, the pharmacotherapy required to achieve remission with her first episode resulted in neuroplastic changes that increased her likelihood of experiencing additional depressive episodes. C, the scientific literature suggests that the loss of a sibling is the life event most closely associated with recurrent episodes of major depressive disorder throughout adulthood. Or D, response to pharmacotherapy often takes a minimum of 8 weeks, and MT is much more likely to achieve remission if her husband can continue to provide the necessary support through her remission period. So, it's a long question and there's a lot of info in the answer choices, so you may have to go back and actually evaluate what precisely is being asked of you. Sometimes when you find yourself getting lost in a question, there are several sentences, and then your answer choices all have a significant amount of information provided. Sometimes you have to go back to the question to be sure that you answer exactly what is asked of you. And in this case, the question is, in trying to help NT's husband understand the disease process, the psychiatric mental health nurse practitioner discusses with him that. So what we are looking for here is an explication of the disease process of major depressive disorder. So as you evaluate your answer choices, A says the physiologic stress accompanying her first episode of depression may have produced changes in brain biology that make her susceptible to subsequent episodes without an external trigger. And that's a very true statement. That's a very reasonable episode. Remember that physiologic changes can occur in neurons that actually, change receptor expression and change the way that the synapse responds to or manages concentrations of neurotransmitter. So yes, absolutely. When patients undergo an episode of depression, there is potentially a change in neurobiology that changes things going forward. And it is very true that physiologic stressors accompanying the first episode may produce changes in neuroanatomy, really, in the biology of the brain, that make her more susceptible to subsequent episodes later, even without an obvious external trigger. So A is a very reasonable answer, but we always look at B, C, and D, right? So B says the pharmacotherapy required to achieve remission with her first episode resulted in neuroplastic changes that increased her likelihood of experiencing additional depressive episodes. That's not a good answer. While it is true that pharmacotherapy can produce neuroplastic changes, those neuroplastic changes are typically positive ones. C says the scientific literature suggests that the loss of a sibling is the life event most closely associated with the recurrent episode of major depressive disorder throughout adulthood. And that is just not true. Actually, the most compelling data for life events that suggest losing a parent before age 11 is the greatest life event risk factor for major depressive disorder. And then finally, D, response to pharmacotherapy often takes a minimum of 8 weeks, and MT is much more likely to achieve remission if her husband can continue to provide the necessary support throughout her remission. D might actually be a true statement, but it doesn't answer the question. The question is, in trying to help MT's husband understand the disease process, the NP discusses with him that. So the question is about understanding the process, not about facilitating the recovery. And so this is a classic example of how sometimes one or more answer choice may actually be a true statement, and it may even relate to the question, but it doesn't answer the question directly. As you look at these four, the bottom line is that A is the correct answer. Stressful life events often do precede a first episode of depression, and one theory suggests that the physiologic changes that accompany this episode place patients at higher risk for subsequent episodes in the future. That's a true statement. There is no evidence that pharmacotherapy increases risk. Can pharmacotherapy produce neuroplastic changes? Yes, but those changes don't increase the risk for subsequent episodes of depression. That's why B is not a correct answer. And again, the most compelling data for life events suggests that losing a parent before age 11 is the greatest life event risk factor for major depressive disorder, not that the loss of a sibling is most closely associated with recurrent episodes of depression. So while losing a sibling might be associated with a depressive episode, C is not the correct answer to the question. And then again, while response to pharmacotherapy does take up to 8 weeks, and certainly it is true that she has a better chance of remission if her husband can provide the necessary support, this is not an etiology. This isn't, D will not help MT's husband understand the disease process. So this is an excellent question in helping you review not only potential etiologies of subsequent episodes of depression, but also in dissecting the anatomy of the question. When you read a question, especially when it's involved like this one, and you have all these answer choices, and a couple of them you think, oh, that's true, or that could be right. It is very important to go right back to the question and answer exactly what it is asking of you. And in this case, what it is asking you is, in trying to help him understand the disease process, you discussed that. And in trying to help MT's husband understand the disease process, A is the only answer that works.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.